DI and SIADH are two endocrine disorders that nursing students constantly confuse. In this video, we're going to break them down clearly so you can recognize them on exams and in clinical practice. Welcome to Nursing Study Lab, where we make nursing school simpler. Antidiuretic hormone, or ADH, works in the kidneys to help the body retain water. When ADH is functioning normally, it helps maintain fluid balance and blood pressure. With diabetes insipidus, there's too little ADH. With SIADH, there's too much ADH. Diabetes insipidus, or DI, occurs when the body does not produce enough ADH, or when the kidneys do not respond to it properly. Without ADH, water is not retained. Syndrome of inappropriate antidiuretic hormone, or SIADH, has the opposite problem. In this condition, the body releases too much ADH, causing excessive water retention. First, we'll start with DI's key symptoms. Because the body is losing water, patients with DI experience large amounts of urine output, or polyuria, intense thirst, or polydipsia, and signs of dehydration. There may be hypotension and tachycardia as well. Then we have SIADH key symptoms. In SIADH, water retention leads to fluid overload. Patients may gain weight and produce very little concentrated urine, which is also known as oliguria. There can be symptoms of confusion, headaches, and nausea and vomiting. In DI, there are a couple different body effects. Ongoing water loss leads to dehydration, leading to decreased circulating volume and increased serum concentration. This is where you get your weakness, dizziness, tachycardia, and risk for shock. SIADH has a couple of different neurological signs. As excess water dilutes sodium levels, the brain becomes affected. Patients may develop headaches, confusion, and in severe cases, seizures. They may experience lethargy, restlessness, disorientation, and muscle cramps. The laboratory findings that you're going to see with DI all reflect dehydration. So while looking at these labs, you need to think, okay, the patient is losing water. So what's happening in the body? They are going to have a high sodium level, a high serum osmolality, and then a low urine specific gravity and low urine osmolality. That urine is going to be very dilute. The laboratory findings for SIADH are going to be opposite because the patient is holding water. So they are going to have excess water diluting the blood, which leads to low sodium or hyponatremia, low serum osmolality, and a concentrated urine, which is a high urine specific gravity and a high urine osmolality. Now that you know what DI is and what laboratory findings there are, let's look at what causes diabetes insipidus. It can be caused by head trauma, pituitary surgery, medications such as lithium, or it may occur without a known cause. The causes for SIADH originate or are associated with the central nervous system and injuries that occur there. So head injuries, strokes. There could be a CNS infection, certain medications, and then small cell lung cancer can also cause SIADH. We're going to look at the treatment options for DI and SIADH. Treatment for DI focuses on replacing fluids and administering desmopressin to reduce urine output. There could be IV fluids. You're going to take daily weights. You're going to monitor electrolytes, and there's going to be a strict intake and output in place for the patient. While the treatment for DI focused on replacing fluids, treatment for SIADH focuses on fluid restriction and, in severe cases, careful administration of hypertonic saline. There will be loop diuretics prescribed, seizure precautions will be in place, and just like DI, there will be a strict intake and output. The nursing priorities for DI include monitoring intake and output, preventing dehydration, and closely monitoring sodium levels. You're going to be taking daily weights, and you're also going to be monitoring vital signs. Just like with DI, your nursing priorities for SIADH are going to be to monitor sodium. You're going to take daily weights. You're going to focus on fluid restriction, seizure precautions, and monitoring for any neurological changes. Both of these disorders involve ADH, but they cause opposite problems. DI leads to dehydration and high sodium, while SIADH causes fluid overload and low sodium. There is a lot of information to remember about diabetes insipidus and syndrome of inappropriate antidiuretic hormone, but a simple memory trick is using the first letter of each condition. So the D for DI is going to equal dry inside. The S for SIADH is going to equal swollen inside. Remember to look at your urine outputs and your sodiums to identify which disease you're looking at. Follow Nursing Study Lab for more nursing made simple.